So hi everyone, it's lovely to be here today, and thank you so much to Genova for inviting us. It's actually always a treat for me, Andrew and Priya, to get together because we're so scattered over the UK, and it'd be nice to meet as many of you as possible as well, so please do come and find us at our table just through there afterwards. I'm Isobel, and I work up in Edinburgh with the other Mosaic doctors. So I'm going to do similar to Priya, there we go, and chat through a case, and I'm going to do a bit of an emphasis more on the mitochondrial part of the panel. I think that bit especially can be quite confusing to people, so we'll just break that down a bit. So this is our lady. So she's a 40-year-old, and she's had a 5-year history of worsening fatigue, brain fog, and some intermittent rashes. She's had multiple chest infections and antibiotic use. And interestingly, her fatigue and brain fog worsened when she went vegan, and she then developed some neurological symptoms, so numbness, nerve pain, and slurred speech, which is obviously quite alarming for her. That's okay. She's now self-injecting B12 on alternate days, and this has improved her symptoms by about 70%, but she's still just a bit stuck with fatigue and brain fog, which is why she came to see me. She's been on levothyroxine for quite a long time, and as I said, she's on the B12 injections, and she had a very high multi-symptom questionnaire score initially. So I think Priya mentioned that it's a score that we do at the IFM, where it takes you through different body systems basically and gives you a score. So 133 is really quite a significant score. Oh. So I'll just whiz through her timeline as well, just to give a bit more context. So this was a lady who's had a difficult childhood. So she's had multiple adverse childhood events. I don't know if you've seen the research about adverse childhood events, but there's links with having trauma in childhood and poorer health outcomes later in life. She also had very part of her ACEs is that she had a poor relationship with her mother, which is still a problem today. Unsurprisingly, perhaps, she's had low mood and anxiety from childhood, and a history of hypermobility. In her teens, she developed fatigue. She said she felt more fatigued than other kids in her school. She had Raynaud's, and she said she felt very socially isolated just from a young age. In her 20s, she developed hypothyroidism. Unfortunately, it wasn't really clear whether that was Hashimoto's thyroiditis or a non-autoimmune thyroiditis. So this is a bit of a problem with hypothyroidism, in the UK, is that it's not necessarily differentiated if it's an autoimmune cause or not. And obviously in functional medicine, that's quite important. We need to know what we're dealing with. So she was sort of okay until that time, and it was just really when she was 35 that she started to develop the fatigue, brain fog, and dizzy spells. And at 38, she had a really severe chest infection, which required 5 courses of antibiotics. So whether that was a really severe bacterial resistant pneumonia that she had, or whether she just had a viral infection that was mistreated, I guess we don't know, but she had a lot of antibiotics during that time. She was unwell for about 3 months, so it really knocked her off. And at 39, she went on a vegan diet, and we'll go through her food diary and have a look at whether this is a good quality vegan diet or not. But and around that time as well, she did 60 minutes of boot camp daily, so she was doing a lot of exercise. And she then developed severe fatigue, pains down her left side, numbness in her cheeks. That's when she started getting slurred speech. So really quite alarming for her. And she went to see neurology, who did lots of tests, head scans, had a good look through everything, and they couldn't find anything. She bought B12 herself from Germany, started self-injecting that on alternate days, and that did help her a lot. So I'll just pick out some bits of the matrix. I won't go through all of it. So like Priya said, this can just be a really helpful way to just have an overview of what's going on with your patient. So in terms of her ATMs, her antecedents, I think it is relevant that potentially relevant. Her mum had a history of anxiety, depression, and substance abuse. She had this adverse childhood events. she had antibiotics in her childhood, like most people do. She had hypothyroidism. Her triggering events for her fatigue certainly seemed to be the fact that she had these recurrent chest infections. She was doing a lot of exercise, and she went vegan all around at the time that she became unwell. And she's got ongoing sort of exacerbating factors now that are probably contributing to this picture. So there's quite a lot of stress going on. She's not sleeping brilliantly. She suffers from anxiety. She's still vegan, and she's not having a brilliant nutritionally dense vegan diet. She's got ongoing B12 deficiency. So those are all things that we kind of need to be thinking about. And in terms of her lifestyle factors, there's a lot actually to be addressing with her. So she sleeps for about 6 hours a night. She's got problems getting to sleep. So she's not sleeping perhaps enough. She's not really moving much. She sometimes walks to the shops. So she could definitely be doing better with that. Nutritionally, she's vegan. She has 2 meals a day. She says she does mostly eat whole foods, but like a lot of people, she eats too fast. She struggles with nutritional advice. She's confused about what she should be eating. She comfort eats as well, which is really, really common. She doesn't drink any alcohol. In terms of stress, you know, she has tried to put some good stress interventions in place. So she meditates and she does breath work daily. She's got ongoing therapy for childhood trauma. She's got 2 kids, and she says that she doesn't have any time for hobbies due to childcare. And relationship-wise, she's got a good relationship with her husband. He is away for work half the time, and she's got 2 kids, one of which just does need quite a lot of support. She's estranged from her mother, and she's not working at the moment due to fatigue, unfortunately. So it is really quite significant. Okay, so for the initial treatment plan, we did a full elimination diet, which is something that I do with quite a lot of people. So elimination diets is kind of the gold standard way of addressing for food, for looking for food intolerances and food allergies. So she did that with a health coach that I work with. Like Priya, I'm a bit obsessed with digestion and chewing. So we went through that in a lot of detail and got her to chew her food more, sit down for meals, try and be in a parasympathetic state when she's eating and not in sort of fight or flight. We discussed the importance of reducing blue light exposure before bed. So ideally making the room a no phone zone, thinking about using blue light blocking glasses in the evenings, you know, especially in winter. And we discussed kind of having a nighttime routine put in place. She's also going to chat to her husband about if she can make more time for herself. And I recommended the book, The Miracle Morning, which is a self-help book that I think is really fantastic for a lot of patients. So it basically guides people about how to create a morning routine that is kind of positive and empowering and helps people to start the day in a good way. And, you know, it doesn't, you know, this could be a 10-minute routine. It doesn't have to be an hour. And at that point as well, we ordered the metabolomics. Oops, can't work this. Okay, so I just wanted to chat a bit about mitochondrial function. So the mitochondria are the power station inside our cells. So they turn food into chemical energy, and the currency of energy that we use in the body is called ATP. So the mitochondria also help to metabolize toxins and tell the cell when it's time to die. This is called programmed cell death and is, you know, really important when thinking about cancer. And the mitochondria make about 5 kilograms of ATP a day, which is quite impressive. And size for size, they produce the electrical energy of a bolt of lightning. The mitochondria are very susceptible to damage, and the highest concentration are found in the brain, the retina, the heart, the muscles, the tongue, and the liver. And therefore, these organs are very susceptible to the deprivation of glucose and oxygen. And mitochondrial dysfunction has been linked to multiple chronic conditions. So I think people often think of mitochondrial dysfunction affecting sort of neurodegenerative diseases, but it's also been linked to cardiovascular disease, diabetes, obesity, and respiratory conditions as well. I still can't get this. There we go. So the metabolome, it looks at the functional markers for key nutrients in the Krebs cycle and beta oxidation as well, and some markers of oxidative stress. So there are other factors that affect ATP output apart from what's included in this test, and we'll come on to that a bit as well. This test doesn't tell you how much ATP is being produced overall. There's not a test out there that can tell you about how much ATP is being produced, plus about all the different factors that can be affecting it. And I think this test is really helpful for looking at actually what are the underlying factors that could be affecting mitochondrial function. It's not necessarily that helpful to know what's the actual ATP output. We want to know what can we modify, what can we improve to get things better. And as with all tests, you know, it needs to be, interpretation needs to be context dependent, and tests need to be done on the right patients to get the most out of them. Okay, so there's three key energy processes that occur in the mitochondria, and we'll go into that in a bit more detail. But there's the Krebs cycle, which confusingly has three names. So you might have seen it as the TCA cycle, the citric acid cycle, and it's also called the Krebs cycle. It's all the same thing, and it uses something called acetyl-CoA. And from that, it produces 4 molecules of ATP, 6 of NADH, and 2 of FADH. NADH and FADH are then fed into the electric transport chain, and from the electric transport chain, that produces 34 molecules of ATP. And then there's also beta oxidation, which is basically how we metabolize fats. And beta oxidation is the prime source of ATP for the liver, heart, and skeletal muscle, and especially in you know, cardiac tissue that depends on beta oxidation for about 60 to 90% of its needs. And the metabolomics really, like Genova really lays this out beautifully actually on the metabolomics test. I think it's really nice and visual and helps us to kind of get a good idea of how all these processes are linked together. So okay, so fats are metabolized via beta oxidation, and this requires some nutrient cofactors, so magnesium and B2. If those nutrients aren't present in adequate amounts, or under certain conditions, so for example, insulin resistance or fasting, fats are not metabolized by beta oxidation, and they'll go down something called omega oxidation. And when there's omega oxidation, these markers become raised. So carbohydrates are metabolized to pyruvic acid, also known as pyruvate, and in aerobic or in anaerobic conditions, so if there's not enough oxygen, the pyruvate is converted to lactic acid. That's what you feel when you've done an intense workout and your muscle starts to get a bit achy. If there is adequate oxygen and there's aerobic respiration, then that pyruvate will get metabolized to acetyl-CoA. And some proteins, so the glucogenic proteins are, the proteins are metabolized to amino acids, and the glucogenic amino acids are metabolized to acetyl-CoA. And you can see here that acetyl-CoA is then at a sort of crossroads of deciding what it should do. And under sort of normal conditions, acetyl-CoA will enter the Krebs cycle. Sometimes acetyl-CoA undergoes ketogenesis, and this occurs in the liver, generally in sort of fasting conditions or when there's inadequate carbohydrates, and it produces ketone bodies. So this is one of the ketone bodies, and that can basically be used as an alternative fuel source and is helpful therapeutically for some things as well. And then the citric acid cycle, you can see, Andy's going to go through how to explain this to patients. She's got a really good analogy, but you can see there's a number of enzymatic steps that need to happen, all which require some key nutrients. And at each step as well, they can be inhibited by certain heavy metals, other environmental toxins, and genetics will play a role in this as well. And then we've got the NADH and FADH, which are produced from the Krebs cycle, and that's fed into the electric transport chain. So those are the three processes. So just to recap, so there's beta oxidation, a lot of that occurs in the heart tissue. There's ketogenesis, which occurs in the liver. There's the Krebs cycle, which is when you then start to produce ATP. So you get 4 molecules of ATP, NADH and FADH, which are then fed into the electric transport chain. And from the electric transport chain, you get 34 molecules of ATP. Oh yeah, that's it. Okay, so I'm just going to chat a bit more about the electric about the electron transport chain. So the way that I kind of think about it is it's like a hydroelectric dam. So in most dams, what happens is that you've got water, which is at a lower level, and it's slowly pumped up to a higher level. When energy is needed, that water is then released and it drives a turbine, and that turbine produces energy. And this is what's happening in the electric transport chain. So we've got hydrogen atoms here, which are being fed up the electron transport chain, and that's using NADH and FADH from the Krebs cycle. And that is driving this turbine here of ATP synthase and producing ATP. And there are some key nutrients as well, which are required in the electron transport chain. So there's vitamin K2 and coenzyme Q10, which you might have heard of. It's a kind of well-known nutrient for a well-known supplement that's used for fatigue. There's quite a lot of evidence for it. Okay, so I also wanted to chat about the effect of light on the mitochondria. So I think in the initial slide, I put far infrared light, but I wanted to chat about infrared light basically. And so you can see here, this is the visible spectrum of light. So these are the colors of the rainbow. We've then got ultraviolet light, which is what helps us to synthesize vitamin D in our skin, and what gives us a nice tan or sunburn. And then we've got infrared light, which doesn't get as much, it's not as well known about. And infrared light can actually act. So cytochrome C, which is part of the electron transport chain, has a photoreceptor on it, and that is stimulated by infrared light. And so this is me sunbathing my abdominal mitochondria. And infrared light, so I live in Scotland, so the UV index is often pretty terrible, but luckily that doesn't matter when it comes to infrared light. So infrared light is felt as warmth on your skin, and we actually live in quite a light deficient society now. So if you think about how we've evolved in terms of we're outside a lot more compared to how we are now, sitting inside, exposed to lots of blue light. A lot of us are actually quite light deficient. And so I actually am a big advocate for, if you're going running, out and about, expose your skin, get actual sunlight onto your skin, and that will help to generate ATP. So this is something I get fatigue patients to do, and especially you know, in the morning, early morning sunlight. I thought we might just have a little brain break, so that was quite a lot of information. So apparently looking at a picture of nature stimulates the right side of your brain and helps you to reset a bit. So this is the Isle of Arran from the bank holiday weekend. Nice and sunny. Okay, so, okay, all energy plants create waste. So excess proton production causes reactive oxygen species to be produced. And what reactive oxygen species do is whiz around the cell and damages the tissues basically, and affects mitochondrial function integrity. So unfortunately, the Western diet is associated with calorie excess, and that can be something that can cause lots of reactive oxygen species to be produced. The mitochondria do try to mitigate this, and there's something called uncoupling proteins within the mitochondrial membrane, which are there to prevent free radical damage. There's also antioxidants, which are there to mitigate damage as well. And the richest source of those are in kind of brightly coloured fruits and vegetables. And we also produce antioxidants endogenously as well. So just looking at Our Lady's results. So she's got, you can see that she's having some problems feeding into beta oxidation. She's got low pyruvate as well, and she's got abnormal organic acids here as well. So what we need to be thinking about is, does she have a deficiency of one of her cofactors? Is she deficient in B vitamins or magnesium? Or actually is she just not really eating? Is she not eating enough? Is she fasting? Is she having a low carb intake? So we looked at her food diary. This is just a one-day one, obviously, but for breakfast, she was having a banana with some cocoa powder, some flaxseed and some nut butter. For lunch, she wasn't having anything. And then for dinner, she was having some lentil bolognese. So I think fair to say that possibly those results could be due to low dietary intake. But also it looks like she probably does have some cofactor requirement as well. So we kind of chatted about B vitamin and magnesium rich foods and thinking about supplementation for that. And then looking down here, so you can see that she's got raised lipid peroxidases and raised 8-hydroxyguanine. And what that's a sign of is oxidative stress. And oxidative stress is when these reactive oxygen species have been whizzing around, creating havoc and causing damage. So this is how I talk about oxidative stress to patients. So it looks really budget, and it was made a couple of years ago. I've never really updated it. But so this is Battersea Power Station. This is where I'm from in London. So I get patients to kind of imagine what's their local power plant. And then I'll say the mitochondria are the power plant that's in every cell of your body, and they're very susceptible to damage. And the things that cause damage are called mitochondrial bombs. So we need to think about what are your mitochondrial bombs, and then we'll talk about mitochondrial bricks. How do we build up your mitochondria again and restore function? So as the metabolomics lays out well, you know, there's certain nutrients which will adversely affect the mitochondria. So magnesium, selenium, B vitamins, zinc, folate, which is B9, coenzyme Q10 is obviously an important one. There's also certain foods, so you know, it is really important to think about if there's any underlying food intolerances or food allergies, which is one of the reasons why we kind of started with the elimination diet. Definitely have a think about trans fats. Are they cooking with vegetable oils or not? Sugar, so sugar is a mitochondrial toxin. And if anyone wants to kind of read more about or hear more about that, then Robert Lustig has written some really good books on that and has done lots of good podcasts and talks about the effects that sugar can have on your mitochondria. And refined carbohydrates and alcohol as well. We need to have a think about environmental toxins, so smoke, pesticides, heavy metals, chronic infections as well, so infections that might be coming from the gut, or viral infections such as EBV, cytomegalovirus, any of the other ones that can cause chronic fatigue, herpes simplex virus 1 and 2, obviously COVID as well is something we need to be thinking about, Coxsackie virus, so lots of potential infections which can damage the mitochondria. Stress, chronic inflammation, for example, for gut dysbiosis. So I think we're a bit obsessed with the gut in functional medicine, but it can drive inflammation, and medication. So really interestingly, the mitochondria are derived from bacteria, and that is why they can be really susceptible to the effects of antibiotics. So I think that's worth thinking about in the context of this case where she's had 5 courses of antibiotics, and that could potentially affect her mitochondrial function. So mitochondrial bricks, so definitely need to start with food. We could be doing the other mitochondrial bricks, but if we haven't really nailed food down, we probably are not going to get anywhere. So having a think about antioxidants, fruits and vegetables, things like broccoli is brilliant and can help to increase your own endogenous production of antioxidants. Generally getting her on a better food plan and making sure she's having all of these different nutrients. And then thinking about other interventions as well, so exercise, cold water exposure, and fasting. So I think the first thing to point out that Andy really wanted me to highlight is this is not me in a crop top. There's not 2 pictures of me in a crop top in this presentation. This is a random woman from the internet in hormesis. So what hormesis is low-grade metabolic stress. And what low-grade metabolic stress does is help to build up anti-inflammatory, antioxidant, and cell defense systems of the body. And there's lots of examples of things that can do this. So I think there is hopefully something for everyone. So exercise, fasting, saunas, cold water exposure, which is definitely a craze at the moment, and infrared light therapy as well. So you know, all of these tools you could potentially use with patients, and people will have access to, you know, to different things in their areas. So find something that really sings to that person that they can really get on board with. So just a couple of other bits from her test. You know, generally do start with the gut with people unless there's a really good reason not to. So just having a look at this lady's dysbiosis panel. So she has got some raised malabsorption and dysbiosis markers. That always has to be taken in the kind of clinical context and thinking about her symptoms. So she's having formed bowel movements daily. She's not having any bloating, heartburn, constipation or diarrhea. She is getting some belching and fullness after meals, and that can be a sign of low stomach acid or digestive enzyme insufficiency. And she has got symptoms which could be consistent with increased intraepithelial permeability. So thinking about leaky gut, and you know, leaky gut can drive a lot of brain fog. And she's certainly got risk factors for dysbiosis. So she's had these multiple courses of antibiotics, which, you know, antibiotics are obviously potentially life-changing, life-saving, but can kind of decimate all the good guys in your guts. And she's been on the standard Western diet for most of her life, loads of stress, and she doesn't drink wine or eat grapes or berries, and kind of polyphenols in these foods can be what raises these markers as well. So that's something else to just have a think about when you see these raised. So just a couple of markers, just put a couple of the methylation markers in. So obviously there's loads of different things to think about with methylation, but you know, reassuringly her MMA is looking fine here. So MMA can be raised in B12 deficiency, and you know, you would hope this woman wasn't still B12 deficient given that she's doing injections every other day. And detox as well. So her pyroglutamic acid is borderline, and this is a functional marker of glutathione status. So it can reflect a lack of precursors, or maybe that a lot of glutathione is being used up with oxidative stress, toxic exposures and things. MTBE is from a kind of additive from petrol that has been, it's not meant to be around anymore, but there's groundwater contamination. So that's kind of borderline. And orotic acid as well has been linked to kind of hepatotoxins or underlying liver issues. So just some other things to think about with her. And then her amino acid panel. So this is the metabolomics test. So this is a urinary amino acids, and this can be affected by kidney function. So make sure you do just have a look and check her kidney function here. Looks that that's in the normal range. It represents recent dietary intake. So these essential amino acids all come from the diet, and the non-essential ones are synthesized in the body. Her levels here are normal to low normal, and I guess this is in the context, thinking about the context of what this is. She's on a vegan diet. She's got symptoms which are possibly consistent with a low stomach acid, and that's important because that can be one of the factors that can affect these levels. So animal protein is actually more easily digested than cellulose that's in plants. And when we're thinking about digestion, we need to have a kind of top-down approach. So, you know, digestion starts in your head when you're thinking about food and smelling food and looking at food, and you can sometimes feel your kind of salivary glands tingling and those digestive enzymes being produced. And then you then start eating your food, mechanically breaking it down by chewing. So that's why we need to get people to chew a lot. You then swallow your food and it hits a layer of acid in your stomach, which helps to kind of break down the protein in your food, activates another enzyme called peptin, which helps with that breakdown. That food is then released into your small intestine, and different amino acids are absorbed at different parts of your intestine, but that's going to be affected if you've got conditions like SIBO. So make sure you're kind of having a think about all of those things when you're seeing lowish levels of amino acids. And also different people have different protein requirements. So your protein requirements go up as you age, or if you're, you know, poorly as well. So there's obviously a lot of information that you get back, and it can be really hard to know where should I actually start. So we started with a 5R, which Priya mentioned, which is the kind of gut repair program, and we're thinking about her diet. So we started her on antioxidant and B vitamin rich diet. So this lady was a vegan, and she turned plant-based for health reasons. So I suggested to her that actually it would probably be a good idea at the moment to try and eat more nutrient-dense foods while she's unwell to try and get her B vitamins up. So we had a chat about which food she wanted to do. And I'm a really big fan of offal. Offal is some of the most nutrient-dense foods out there. It's really gone out of fashion. I'm trying to bring it back. It's been very unsuccessful so far. But one easy way to get people to eat offal is to freeze liver. So get like a few packets of liver, freeze it in a block. And then when you're making soups or stews, you can get it out of the freezer, grate it into stuff, and you can't taste it. So we had a chat about that, and she was happy to try that. And she was also happy because she thought her kids would then be eating liver and she wouldn't even have to tell them. She could hide it. So supplementation wise, we started a B vitamin complex, some magnesium, some coenzyme Q10, some NAC and some glutathione for antioxidant support, and then some digestive enzymes which contain some betaine HCl and some probiotics and prebiotics as well. So follow-up wise, so her initial MSQ was 133, so it did come down quite a lot. There's still clearly some way to go with her. Her fatigue and brain fog improved by about 60%, and that was her primary goal. That's what she really wanted, so that was good. She had PMS as well, and that completely resolved. And I find that people often don't necessarily come to you with PMS, but once you start working on their gut and their diet, that also just can get much better. So that was good to see. She had a gluten intolerance identified from her elimination diet, and she started eating eggs and grating frozen liver, which was great. So the next steps, we had a chat about hormesis and her mitochondrial bricks, and she's going to start cold water exposure, so just doing some cold showers, daily morning walk, so getting sunlight on her skin, into her eyes, as well as doing some more exercise. She's going to start doing yoga twice a week. She was working with a health coach as well and doing SMART goals. So I think when you're kind of giving people lots of interventions, it can obviously be quite overwhelming, especially if people are tired, especially if people have kind of busy family lives as well. And we ordered an adrenal stress test and a thyroid profile. And I got her to do the IFM does a toxin exposure questionnaire. So she went and did that as well. So this is actually someone who I've seen fairly recently. She has stage 2 HPA axis dysfunction. She's got some thyroid issues which need to be addressed. And her toxin exposure questionnaire has come back as a few different things that we need to be having a think about. So I haven't seen her since those results are back. That's what we're going to be discussing and working on and thinking about. Does she need a detox program? Should we be looking into environmental toxins as well? So these are my top tips for all patients, all clients, especially people with fatigue, is just don't forget to nail the basics. Food, stress, sleep and movement are so impactful, and I think it can be easy to start thinking that you should be doing super duper gut interventions or mitochondrial interventions, but these need to be really optimized before you can move forward. And it's absolutely fine if that takes that patient 6 months to do that, as long as you've really got that sorted. And just don't overwhelm people with interventions. I think it's easy to get overexcited about things, and just choose the ones that are most impactful and that they most want to do. Thank you.